Good afternoon, Denise, Sekuze, Schaize, Samolyet, Samahanach. I'm honored to be here as presenting in the capacity of Executive Director of Child and Family Services. I'm a proud member of Takla Nation. I'm from the house in Nagyep, Lachgibu, Wolf Clan, and my name is Maushman Gabu, which is White Wolf. So we'll just get right into it. I do apologize. I will be rushing through this. I have a funeral service that I have to get to. So my team, I just wanted to acknowledge all my team, and if my team that's here, if you could stand up. Who's clicking for me? Who is the clicker? Oh, here. Oh, no. Who's clicking? I hear people. It just breaks when I have to do this and that and everything. I just, here. Okay, so this is my team. Click. Oh, you just give it to Joni. Joni will know. So I have Joan Conlon, Don Pearson, Sonia, Elizabeth, Davina Volk, who's sick today, Kayla, Cheryl Thomas, Jody Friars, Jason. That's my team, so stand up, give them a big round of applause. We have a lot of exciting things that we're working on, but before this, I just wanted to acknowledge the theme, or building history together, and you think about this last year or so, and especially just a little while, like how history has been made every day, especially for our Indigenous peoples. I'm just so proud to be Indian every day, but in the last little while, even more so. There are things that happened. Cindy Blackstock joined many children's heroes, including Anne Frank, Malala Yousafzai, Nelson Mandela, when she won, the first Indigenous woman from Canada, winning the World Children's Prize Award, which is like the Nobel Peace Prize, and she just won that a few months ago. Just so proud of her and honored of her. There's about over 40 million kids that actually vote for that. So that was hugely important. We also have just recently the announcement for the $23.4 billion, the largest settlement in Canadian history. We also are going to be negotiating an additional close to $20 billion for long-term reform. Again, historic. Never thought that would happen before. We also had, just in the last few weeks, on October 18th, the first Indigenous premier in Manitoba, Wab Kinew. We had, and what he did again was historic. Out of a 15-member of cabinet, 7 members of his cabinet are women. Out of those women, the Minister of Families, again, first Indigenous woman, Nahani Fontaine, the Minister of Homelessness, Housing and Addictions, Bernadette Smith, again an Indigenous woman, Minister Cable, a Minister of Advanced Education, Indigenous woman, Minister Bushi, Indigenous man, a Minister of the Northern Community Development, but Minister Bushi also was a former Chief of Hollow Water. So all of these amazing historic things that are happening. We also had, of course, Bill C-92. And when we think about all that history, Kerry County Family Services is right there following along with making history. And the way that we do that is through our amazing staff and our amazing programs and our amazing leadership. So the next, what we're doing right now, building history, is we have wonderful Child Safety Director, that's Joni Conlon. She was in that position for just about a year, but we have a lot of great things that are happening. One of the things, when I first got into this role all those years ago, almost 18 years ago, I had said the only way I would take this position if we did things differently, and if eventually we would make our own laws and make our own child welfare system. Well, that day is now a reality where we're doing the work. You'll hear from the jurisdiction team about the great things that we're doing in the last year, but really, again, it comes from our elders and our leaders from the past, with a mandate that we would be self-determining in health, in social, and in legal, and now we have housing. So part of that role that we're having is child safety. And so what we're doing is we're really nation rebuilding. We're looking at taking over all the authorities of the ministry, including assessing whether they're at risk. And if they are, we're going to do it in a different way. We've heard that from community. We know it again and again and again. We don't just want to replicate what the ministry is doing. Why would we want to do that when they have such horrible outcomes for children? So we've been working on looking at what that process would be looking like. So we're going to be developing policy and practice guidelines to support the transitioning of authority and responsibility from the provincial and federal government. So we're going to have a say about where our children go and what services they're going to be receiving. We're going to be really looking at the programming so that we could resume our full inherent right of taking care of our own children through jurisdiction. And we're also making sure that children are remaining connected to community. And that's the part around the clan houses. Again, if a child has to be removed for something where they're being hurt and harmed at home, we need infrastructure, we need resources in community. And our goal, our mission is that no child shall leave community. Now, when we say that, and whatever that child's community is, our own people, we make our own community, we make our own family. That's one of the things that we've always done. So you look at even in the urban setting in Prince George, we have community there. You'll see down in Vancouver, there's community there. But for sure, our children have the right to be with their clan, with their family, and their community. Next. Again, so some more child safety. So we're again working on the legislation, drafting that legislation to ensure that the matriarchs have a role. And what we're doing with the legislation is we're ensuring that the principles that we've developed all those years ago, that has been there forever under our potlatch laws, are paramount when we're drafting that legislation. We also have to make sure that everything we do, how we take care of our children, how we love our children, all of those policies and any work is truly reflective of who we are as Indigenous, as Carrier-Sicanni people. We also have to think about the assessment tools. Right now, one of the issues that's happening with MCFD is that their assessment tools to identify if a child is at risk is not based in our culture. It's a non-Indigenous tool, so we can't be utilizing that. So some of the work that we're doing is we're going to be looking at the strengths of the family, implementing signs of safety, and looking at other ways of developing and creating those processes that meet the needs of the family and that is truly reflective of our own laws. Community development, and this is under Jason's portfolio. And this has been, I know, it's been a very huge piece of work. And so it's a new department, well, not a new department, I guess we've been up and running now for 3-4 years, Jason? And so this actually, Jason's department, his director of community and organizational development came when I knew we were going to win the court case. In 2016, I knew that we're going to win this court case. I just knew it. And if we didn't win all of what we wanted, we were going to win some. And one of the things that was important to us is that the communities were able to have the resources to develop their own capacity, because finally we would have resources and more staffing in community. So Jason really oversaw a lot of this. You'll know that we went out to each of the communities and we developed together a novel agreement which was based on the community service delivery plan, which I'm finding out through the rest of Canada that really wasn't done in other places. So it's really an exemplar for the rest of Canada. And Jason and his staff took a bulk of this work. So far we've given over $4 million of direct supports to the nations. So our goals this year is to support staff to have more cultural programming. Each staff is assigned to a member nation to work for both the community development and the cultural teams. Of course, culture is embedded in all our programs and services. And all those years ago, it was just a dream. I know Mabel, Warner, and we'd always think, okay, we need a cultural program, but we never had enough money to do that. And so we're making these dreams a reality. So prioritizing child and family programming and within the nations, and also realizing how the Canadian Human Rights Tribunal rulings and the Capital Directive can positively impact their communities. And again, the CHRT ruling, that's where Canada was directed to stop discrimination, ensure it never happened again, and to compensate the victims. The $23.4 billion is a compensation, and I will speak to that later, to ensure discrimination never happens again. What we're doing is the long-term reform, which is the additional almost $20 billion for that. So we're working on that. Right now, Canada does not have a mandate to negotiate the rest of the $20 billion. We did have the agreement in principle, and we still are waiting to start the negotiations. So some of the wonderful things that Jason's program and the cultural program, there was the Tackle a Girls Camp, which was really successful. We provided supports to that. There are some pictures of some happy young women. We also have what in my department is my director, Dawn Pearson, and that's the early childhood development, and she's got quite the load, and she never says no. I'm like, can we do this? And Dawn's like, yep. And I'm like, who's going to be in charge of this? Me? But she's always there willing to go. So you'll see a lot of these programs that we have, the Maternal Child Health Program, the Canadian Prenatal Nutrition Program, Aboriginal Supported Child Development, the Best Beginnings Outreach Program, Middle Years Program, and the Head Start Program, Early Years Preschool, Child's Oral Health. These are some of the programs that we have. We're always looking at new and innovative ways of providing that support. One of the things that we do at Teegee-Gray, which is unique to us, is that we have a life cycle approach to providing services. So I know I've said this again and again, but I think it bears repeating. Our philosophy is that if you have a healthy baby, you'll have a healthy child, healthy adult, healthy parent. And that's why we have a life cycle approach. And what we do in that we have broken out from 0 to 6, 6 to 12, on, and then we can identify where there's gaps in services for that age group and work together along with Travis's team to get those services in community that is required so that we could have a true holistic level of service, so that we can meet all the needs, and then also really following that life cycle approach as well. Some of the exciting things that we're doing, next slide, is that we have secured funding for the daycare here in Prince George that will be Teegee-Gray specific. We've just been having difficulty finding lands to put that center on. We've been stopping and starting, but it's definitely something that I'm going to make sure we get built this year. We have the Burns Lake Little Angels Daycare, and that has been transferred over to Teegee-Gray Family Services. We worked with the Burns Lake Band to do that, and it's we're rebuilding that, and we're making it, getting it more and more stronger to meet the needs of our community. We're also going to be hosting, this is really exciting, I know it's been a while, but we're going to be hosting the Indigenous Doula training in January 2024, so anybody that likes to be there, to help, prenatally or when a baby is being born. If you like to do that kind of thing, for sure, take that training. We traditionally we had many doulas in our community. We just never titled them that, but we do have that training, so that's going to be exciting. We're also looking again to have the early childhood education training, and Mabel, all those years ago when we didn't have enough staff or capacity, Mabel, made an agreement with one of the institutions, and so we were able to provide that training in our communities, and that makes all the difference. So we are working on getting a building for a birthing center in Prince George, and this is really important because what we found, we were working with the university at UNBC, the hospital, and when we started doing preliminary research a few years ago, what we found was that oftentimes the young women were coming into the hospital and having maybe seen their doctor once and found out they were pregnant, but they were not getting care. So there's that issue. But what we found also is that when they were coming to community, they would come in and they would stay at the hotels or the motels. And of course, they would have their kids with them, and they're waiting to give birth. And so what was happening is that there was actually an increase in ministry call-outs to go to the motels because their kids were playing outside, or maybe the dad was watching hockey and drinking beers or whatever, and people would call from everywhere. So, Sarah Hine and I met with the university hospital, and said, well, what can we do? So there's two things that we're doing. One of them is like really the vision to have this birthing center, a nice place where families could be together, especially when there's a high-risk pregnancy and they have to stay for 2 or 3 months. You could imagine if they're staying in a motel, it's not very good. So that's one of the things that we're doing. And we're also going to have Sarah's house, which I'll talk about later. We have guardianship and post-majority services, and that's under my director, Sonia Rowland. And this is just, again, we're really lucky that we have the program, because this is where we're taking care of all our children in care, and the principles and the values that we have, that we share, are really coming from our communities and the way that we take care of our children. One of the things that we talk about is, for me, is when a decision is made for a child, I often say, would that be good enough for your child? And if that doesn't stand that litmus test, then why would it be good for anybody else's children? And we're able to do that because we have a lower caseload. So 1 social worker to 8 children is what we currently provide. And in some cases, it can be lower. We also have the roots workers that are completing the family trees. We're going to be, I always think about how important it is, because our children in care, many of us grow up, you have your pictures and you have your stories of your families, and you kind of have that. But our children that have been placed in care for years and years may not have all of that. So really what we're doing with the guardianship social workers, when we do all of the writing and we do all the reporting, is actually we're telling their life story, and every child deserves that. So it was really, I think we were just so happy when we finally had the funding again to hire these ones to give the children their history, and they deserve that. So we also have the post-majority, and we have the ages is from 19 to their 27th birthday, and that was a huge win for us when we were negotiating the agreement and principle for federal funding. It was a huge win. I think that was it was just a real happy day when we got the post-majority supports in place, because I know that starting all those years ago, 18 years ago, looking at the politics of healing, as I call it, one of the first resolutions that was, Warner, of course, helped me do this, was bringing forward a resolution so that we could have post-majority services, so services after they're 19. I think many of us, like I'm still mom's baby girl, like we're still our children's babies, and so to get kicked out of the house at 19 was unrealistic for especially Indigenous kids. So that's a huge important program for us. And so the way that we do it is, if they have a social worker and they reach 19, that social worker just continues to be with them to help them through that. So it's something really important for me. There's life skills that we're providing. We also have funding, and these post-majority supports are really going to be important when I talk about compensation, the compensation that's coming down. Our resource services, and these are the homes, the caregiver homes or the foster parent homes. So our workers complete out-of-care assessments and home studies for adults. We prioritize community members who want to care for their relatives. So anybody there that's willing, and don't forget, it's also like even if there's a single person, they don't necessarily need to be a couple. If somebody is willing to take care of a child, especially when they're living in community, like bring them forward, and we can provide the training, and we provide just amazing supports, way better than anything ministry ever does. So that's really important. But even the out of care, we're able to provide out of care options, and so we're able to do those assessments. So if a child needs to go to a relative, we can do those assessments and then provide this ongoing supports. We're also, Resources also working with guardianship and other agencies to open up a post-majority housing program here in Prince George. And this is one of the things that, I love the name of this place, because when we're asking the youth years and years ago what did they dream about? And I always say this is one youth, like the youth they're dreaming about becoming doctors, lawyers, and whatnot, but there's other youths that I dream about a day when I only have to read about the impacts of residential school, not have to live it. And so we sort of named this, that it's our place for our children to dream, that they're safe to dream. And so I'm really excited about this place. I think we have 12 units, but we're looking for more and more units for this, but it's supportive. Like we're partnering with Nasal Bay Friendship Center. We also, thanks to the board and Warner, we do have the ability to perhaps purchase what was that motel called? the motel, what was it called? Yeah, the PG Highway Motel. So we're looking at that and to have more places for our young people. We also have Bring a Tradition Home training monthly. We have the de-escalation workshops. We have trained, and we provide this training to caregivers and out-of-care providers, and it's really important that we do this. So our providers are providing the best training or the best supports that they can. So our prevention services, now this is a long list again. So we have from our own community, Cheryl Thomas. She's the director of prevention services, and she's history. She's been, how long have you been? 24 years with CSFS, so she's amazing. So we have the Family Preservation Outreach Program, which is, the housing, and we provide, we have hampers, we find housing for those that are difficult to find housing. And that little team, it's just amazing that they'll find, and I don't know how they do it, when nobody can find places to rent, they'll find houses to place. They work directly with the landlords. It's made a total difference in getting the people that are at risk of homelessness to find homes and families. We also have the Family Preservation Urban and Community program. Now this would be one of the first contracts that CSFS entered into all those years ago, and it's really unique in the way that, because we provide those services to everybody in Prince George, First Nations and non-First Nations. So everybody that comes will have access to this family support. Now, I always say this to leadership and to the board. If you have somebody that is moving to Prince George, a family, especially if they're young parents or a single mother, give them the contact for Cheryl's team, because we can provide supports. They don't have to be in any threat of the ministry. They don't have to be. Sometimes we just find that, especially our young families that are moving here, even to navigate getting bus passes or how to get certain things. So at least we could give them an orientation to the city. They'll get to know our workers, and they'll know before things get rough that they could call on us, especially when it comes to issues around poverty. And then, coming from community, you have auntie, uncle there, or you have your parents there or something, then all of a sudden you're on your own, and you may not have enough food, but there's things like that we can help with. Again, we have the intensive family therapeutic services, and this was transferred over from Travis, and I'm always so proud of this program. And this is where there's 24/7 care for 5 weeks, and we definitely are trying to expand that into our communities. We have the wraparound parent guidance and support. Again, very successful, and if you ever get a chance, especially for the board or the leadership, just to go out there and to do a little tour of the supports that we provide. I love going to that place. Parents are there, and they're taught hands-on parenting skills, and so it's really exciting to see just how much that program's grown. And I really have to give a shout out to Lisa, she's just amazing. What's her married name? Redland, yeah. So yeah, she's amazing. She's really grown that program. We have the Family Empowerment Program. And again, these are the supervised visits, so children can visit with their families. Bridge into Employment, one of the most successful program, and it's been about 20 odd years, but we're expanding these programs all to the communities this year. It's already out in Burns Lake, and the reason that this is so successful, I think, again, it's not only our curriculum, but it's also the heart of our people. Samantha Wertak has been there and just loves the work she's doing and loves our people and really tries to help them. So this is one of our prize, I would say, programs, because people that have taken this program, sometimes they're almost on the line of being homeless, and they're perhaps leading very precarious lives, and they'll come through the program, and so they're still working. Some have gone on to get their university degrees. It's really a wonderful program. We also have the Safe House, and I really have to give Cindy McDonald or Cindy Adams a huge shout out, because that's a difficult place to be. But her and her staff have really worked hard to provide the supports for our women that are at risk and are fleeing violence or are in a precarious situation. So I know all of those programs are amazing, but it's just again, the reason these programs are amazing and successful is because of the heart and the ability of our amazing staff. We also have some groups, our family support groups. Next slide. These are some of the support groups that we have. If we don't have them in your communities, that's what we're trying to do. Our goal is always, whatever we're having in the city, we're trying to put them in the community. And again, it's really hard to get the staffing in community. So we're looking for novel ways of doing that. Youth services. So we have Prince George here. We have the Skyzaya. That's our Children of Chiefs house. We have the 18 and under programming as well. In Vanderhoof, we have Sio, my house. Burns Lake, we have the youth services. Right now, it's within the Tilcasco office. And we have, of course, the partnership with the Foundry. And this is one of the more amazing programs that we have. And we never had funding for youth services until we had the prevention dollars. So all those years prior to 2018, 2019, it was literally on a wing and a prayer by little surpluses, if we ever had any, by writing proposals, getting grants, and it was a continuous, ongoing battle. And so oftentimes, I always say this, I would give our staff, our little youth staff, their 2-week notice or a month notice to say, sorry, you guys, I got to lay you off. And then in a week or so, I'd get like, oh, I got a $50,000 grant. Yay, we lived to ride another day. And that was how it went with our youth services. And I just wanted to give a special shout out to, so proud, our newest director, Kayla Brownscombe, who stayed with me through those rough times. So we also have another director of youth services that can't be here, but really for the community. One of the things the community, and definitely heard from the chiefs and the leadership, that you really wanted youth services better in communities. We know that we had transferred the funding for youth care workers in your community, and it's been very difficult to hire those positions. It's also been very difficult for training. So we have a director that's going to be concentrating on the communities. And again, I just think about when Mabel and I, when we had just this little lump sum of money, and she said, Mary, here, you're going to help develop this youth program. And Mabel, did we even have $70,000? I don't even think we even had that. 50. Oh, yes. And then I hired Marilyn Jansen. Yeah, that's right, too. So she was there. And Pam Heron was one of my youth workers. And we had, again, it was proposals and proposals and proposals. And look at us now. Like, we have youth centers. We have this dream. Like, we are definitely building history. So I'm really excited about that. So these are some of the things that we're doing. We provide youth with opportunities, Walk Tall, Pride, the Yak, and this year we're going to be having, again, our culture camps. What we did in the previous years was that, if you recall, we held culture camps every year, and then in the fall we would have the warrior camps. And those warrior camps, I know now, is a model that they're using across Canada. But one of the things that we did, because we really... We learned through the tough times when we were having our first culture camps all those years ago. And that culture camp was a really good joint collaboration between Health Travis, Mabel, myself, getting those culture camps together for our children in care. And what we found was really heartbreaking, but also was beautiful, was that so many of our children hadn't even gone back to their home territory before. And so this culture camp was their first time that they actually met family. So we're going to be having those camps again. I know that's something that Warner has wanted us, and to do that again. That doesn't mean that the communities themselves, the nations themselves, can't have their culture camps, but this, will have a bit more structured again, and then having the kids in care again at these camps. Yeah, and some of them, first time they touched salmon, exactly. It's quite amazing. So some of the pieces, again, we really have that holistic look, teaching them the spiritual, the physical, and I'm so happy that Amy now, who was a former director, who's just done an amazing job, and a huge shout out and commend her for all her passion to get the youth program where it's at today. And so now that she's the director of healthy activities and physical activities, there'll be a lot more work with Amy, I'm sure. We also have to make sure that when we look at the youth themselves, that we hear what they're saying. And so we do have advisory councils that actually tell us what they want. And so that's really important to us. Coming up this next year, we're also going to be working with Tom Patterson under Travis's department, where we do have the Bachelor Social Work program through NVIT, but we're working on the Youth Care Worker program. Kayla, take some notes. And what we're going to be doing is having those youth staff now, and even the ones from before, to have focus groups to really shape that youth care worker program, and eventually it will be a degreed program, the way that's going to meet the needs of our community and specific to our Indigenous communities. It's very hard. We don't have any youth care worker programs at UNBC or CNC. We tried to partner with Douglas College. It's been quite a few years. I don't know, 12 years, even when with Mabel, we couldn't get youth care workers. So now we said, well, we're just going to build our own. And so the youth care worker program will be coming. Hopefully we'll start the pre-work in January. We also have definitely heard a need for the youth treatment center again and again. So that is a big initiative that we'll be taking on, but it won't just be CSFS. I've had meetings with all the other executive directors in the North, the Gixon Child and Family, Haida Child and Family, and we've come together to say we're going to work on this together to look at not only do we need the land-based healing centers, but we also need like the actual real medical, the detox. You could see that when you're downtown Prince George, they're getting younger. So I did have a preliminary meeting with a representative of children and youth, and potentially some options are actually to look at the perhaps at the youth custody center, because there's very few youth in custody. It's a humongous place. They did make a youth treatment center out in Agassiz before from the youth detention center, and you can't even tell it was a youth detention center. So there are options that we'll be looking at. I know that Notley has some ideas, that all of us are sort of working here. Tackle has some ideas. So what we'll probably do is convene a meeting of all of us together and say these are some of the options, and then really hold the politicians to task. I did have an opportunity to meet with Minister Whiteside. She's the Minister of Mental Health and Addictions. And so she had stated that it would be a priority for her to have something in the North. I also work with the other 24 agency directors, and we did develop a youth mental wellness strategy. So there's that, and basically what we want to do is pull all the different ministers to come together and say, how are we dealing with this tragedy that's happening in front of our eyes, the opioid crisis when it comes to youth mental well-being. We need to look at innovative ways of providing those services to our communities. One of the things that I know for certain is that the CSFS, the e-health, the telehealth program is one of the best, if not in Canada. And so we need to look at perhaps having an e-social program or something to get the services into community via outreach, because we can't get the bodies in this way. We need to be innovative, which CSFS is very good at doing. I'm going to just quickly go into thank you, everybody. I just wanted to thank again my staff. You're amazing, the leadership, and really the support of the board and our leadership for getting us to this place. Some of the other updates I wanted to give you is that you've heard about the compensation. There are information sheets that were just completed today. I've put them on your table. So what we're doing is we're going to be ensuring that there are those supports in places. We've heard it not only here but through Canada, that when the money starts rolling out, that we have those supports that we can start getting into place now. We're asking for Canada and the class action lawyers to let them know that we need to figure out how to get what we're calling surge capacity dollars, so that we can get mental health workers, so we can figure out where the priority needs are in community, because you could imagine if you're giving people that are already hurting that much funding and what's going to happen. So we also are working on, we have to work on a distribution protocol, which is our next step. And that distribution protocol is going to set out the eligibility, the criteria, the procedures, and all the necessary forms to be filled out. and the supports for all the beneficiaries. So that's the distribution protocol. We already have been sort of working on a draft over the last few years, so we have an idea what that's going to look like and what a best practice is. And as I said earlier, one of the things that we didn't want to do is to re-traumatize our children and the caregivers. So we've looked at and we've settled upon a criteria of eligibility based on, how many placements, what age they went into care, all of these different criteria, which not to interview them. And that's really important. So we do have that information sheet. There will be more and more information coming out. We do have a communication strategy. And we also have a 1-800 number, which, we have a 1-800 number. But one of the things for certain we know is that our kids aren't going to phone a 1-800 number. We know that. So we need to look at different ways, like how can we talk to our kids, like through TikTok. Even Facebook is just for the boomers, as they say, the old ones. Even Instagram, they're like, yeah, boomer. So TikTok, Snapchat, all of these things. So we have to be, it's led by the youth anyway, so this communication will take care of that. But before I go, I just wanted to say just a few little closing comments. Last year, our theme was, about being trailblazing, and that was our AGA theme. And so while we are here today, I got to think we can't think about building history together without thinking of what we've already achieved. One of the things that Nelson Mandela had wrote about in The Long Walk Home, and in the first few pages, he said, when you're climbing up a mountain, you always got to take time to turn around and look at the view. And I think oftentimes our staff and our board and everybody, that we forget how much we've already achieved, how much history we've already made. One of the first family law models, we did that all those years ago, and we had no money. We developed a research program all those years ago, and we had no money. And we just kept doing these things even though they said we couldn't and we had no more money, but we just did it anyways. So we have this amazing telehealth program, the best in Canada. We have like 14 doctors that work for us, all these specialists. And again, that's making history. We're building this history. We have C92. We're drafting our legislation. We're doing the training. We have the community wellness teams that we never had funding for. We have funding for that all. So all the stuff that we're doing, we have to remember that we have to take the time to look back and say, this is where we've come from. And look how good we did, and look how much we achieved together. And we did that together with our combined spirit and our combined strength. And so you could imagine, starting today and moving forward, think about your role in that. Our staff, our board, I say this all the time, is that one day, 100 years from now, you are the ancestors that those not yet born will speak of. And that's what we are here to do, is that we are building history together. And for that, I am honored to walk with you. Masai.
Thank you, Mary. As you know, Mary has to leave.
I'll do one question.
One more.
No, I'll do just one more question. Yeah,
okay,
one question.
One more question.
Yeah. Okay, Chief Maureen.
Chief Maureen has a question, and then just before we get there, just want to announce we have 84 people online, 52 in the room. Those are pretty wild numbers, right? Pretty wild. Here you go, Chief.
Okay, Masai David. Mary, thank you. Your reports are always excellent. You're a great speaker and a great presenter, and I think your leadership is outstanding with this organization, and I just wanted to commend you on that. Every time I hear you speak, I learn something new, and the entire world of child welfare has grown so enormously in the past few years that there's still so much to learn about it. And I think the last time that you and Jason came to our community, there was 2 occasions where you presented, I think, the budget for the band designated rep, and then the second time, I think you came and did consultation. And so I just want to welcome you and your team to be in our community more often. And be in every community. And I really appreciate the report and all of the urban development. I also want to encourage more development inside community because that's really where the issues are. And more recently, we've been experiencing a lot of issues with our youth. I did send an email. I think you received a copy of it. I don't need to express all the details, but I still feel that that email is still relevant. I sent it to you and Warner and some of your other staff. The issues in there still remain relevant, and they still need to be addressed. And I would like to work with your organization to address them. And so I also commend the work that's being done by yourself and Cindy Blackstock. I think it's, you know, making national news and international news, and I think the work that has been long overdue and how our families and children were treated over the decades by government, not only by colonialism or assimilation tactics, but by the way in which they have removed children from our communities and how they are now you know, reconciling all of the things that they've done to our people. And so I didn't realize that you were here with 18 years with CSFS. Congratulations on that, that time frame. I had to write that down when you said it. Just the other day, we met with Trish Nazell from the Anabip program and 2 of her team members. And so she advised me that Office of Wet'suwet'en is doing negotiations on jurisdiction, and that they are a non-delegated agency right now. So we met with them, and we want to collaborate with them because we are Wet'suwet'en. Many of us have Giksan Wet'suwet'en roots. And I'm sitting at this table with some of your staff and sharing information with them and sharing information with Trish, because the work that they are doing is very land-based. It's based on Wet'suwet'en language, culture, and traditions. And with all of our elders that we've lost during the pandemic, they were language speakers. And so we're going to utilize that as a resource to help our community. And so I want to encourage your staff to collaborate with them. They have a Prince George office and they have a Vancouver office. And a lot of things that they're doing, like the women's empowerment, the men's hunting, so many initiatives that they're doing that really excite our people, because Danielle Wall is our family advocate, and she's a language teacher and has been going to school to learn the Wet'suwet'en language. And I just wanted to express my appreciation publicly for Joni Conlon. She's one of our greatest resources within your department, and we're just sorry that she left Burns Lake and kind of left the work that she was doing for us. And I still would like to encourage anyone in your department to look to the work that she's done and the relationships that she's built and the rapport, very strong rapport. And Joni was just sharing with me that she took the training for compassionate inquiry. So I could see the difference in her personality towards our people and how people are just drawn to her, and I expressed that to her. And I also suggested that with the frontline workers, if you were to utilize the services of Ember of Hope, here I am promoting them, but you know, it's for good reason, is that if you brought Ember of Hope into this room and formed a circle with your frontline staff, I think that would be a great beginning for your staff to be exposed to that healing initiative and to be able to spread that out into the communities. But it isn't just child and family, it's also the health as well. And so I just wanted to say thank you for your report and just recommend that CSFS have increased the presence in our community. I don't speak for any other community, but I would like to see more established initiatives that are inside Wet'suwet'en First Nation, or you know, where our clients can go. I'm just learning today that there's things happening at Burns Lake Band, and I wasn't even aware of it. But I mean, it's good for me to come here to learn this information so that I could bring this back home. And I find all of the reports are quite useful. And you know, I bring it back to our council table, and I bring it back to our frontline worker tables, everything that I learn. And so I think the day before, Marlena sent out that, that link so that we could respond to your your questions, and all of our staff responded. And I sent it to every one of them, and I asked them, please respond to these questions that are being given by CSFS. And so I'm grateful that Wet'suwet'en was well represented in the questions that you guys asked of us about your programs and services. And I also want to commend you for the questions that were asked. I think it's Marlena and Andrea that put those questions together. And they were just very unique, well thought out questions that were presented to our people. And also, Andrea Palmer came and spoke to me about, her work with the communications, and I just appreciate all the staff coming to, talk to me about the work that they do and how they can support Wet'suwet'en, because I just kind of feel like we're not remote, we're not isolated, but I just think that we need to touch base more often. And the last thing I wanted to say is that I'm not really clear about the training that's been provided to our child and family. And so I keep asking the questions, but I still don't feel clarity around that. So I would like to understand that more about what training is offered to our child and family. And if it is still ongoing, or if it's, I don't know how that's all unfolding, but it would be really nice to understand that more. So I realize you have to go to a funeral, so I'm going to stop there. And again, appreciate the work for you and your department, Ms. Sai.
Thank you. Yeah, there's a lot here to unpack, but for sure, we are having the band designated representative training again. That'll be for the frontline staff. We've had to postpone that, but we have that's ongoing. We also have any of the community information sessions around knowing your rights of a child that we provide to community, and again that. Sonia's staff does that in community. You also have your own worker under Jason's program, and I know Jason is in connection with your staff. So whatever those training requirements are, we also are going to have, and we do have our youth staff training. And so that'll be as well. That's going to be ongoing training as well for any youth staff. And I understand that most of the nations don't have youth workers yet. That you are provided funding to do that, and it's been very difficult. So we do have a position that's going to be helping the communities themselves with their youth programming and their youth staffing, so that they can support them. The community service delivery plans that each community has, that we go out every year to look at that. That's what we're basing the priority needs on. So we're going to be doing the same as that. We have to look at the funding piece, and don't forget this year, because the prevention funding went directly to the communities. So that's sort of been the difficult for us, because there's certain things that we can't cover anymore that the communities have to cover. So we're trying to deal with that confusing issue. We do have a submission into the Canadian Human Rights Tribunal where there should be, that money should have never been split. It should be for communities and for the agencies, but it's been very difficult to try to do as much as we can with the support services we have, and then understanding that you receive some money, and we were trying to supplement that. So definitely, really, again, we'll go through the same exercise again, Maureen, where, Jason and I sat with the council and said, okay, are these your priorities again, having those ongoing community engagements? So we'll identify those training pieces at that time as well. Okay, thanks.